but I think there's a logistical challenge involved there. So that's one aspect of what I consider to be the information life cycle. The other aspect is in respect to the information itself, in respect to the whatever it happens to be, the data set, the medical record. It's created, it's stored, it can be scanned, digitized, made available, and ultimately that's governed by various policies, retention policies, an overall information governance mechanism, and at a point in time it becomes appropriate to dispose of that record. All of that has to happen in the most secure environment, and particularly the disposal element. There is an obligation to ensure that information, once it is no longer required, is securely destroyed. So again, we need to think about how we plan and manage that life cycle. And I think that there's an opportunity here, because if we're doing the analysis of that life cycle, if we're trying to understand what the policies look like, if we're trying to understand, for example, good records management practice, we want to know what records we want to store, what records we want to be active, what records we want to hold off-site, what records we want to hold on-site, which records we want to scan. If we're doing all of that planning activity to enable the digitization process, you're automatically delivering a robust set of procedures. You're automatically creating a governance mechanism. You're automatically looking at how you can protect and render secure that information management process. So, I guess this leads me on to where organisations like mine and other service providers, IT providers, any third-party organisation can support. And the one thing I want to make absolutely clear, and this is directly from my own experience, that we're not looking at the NHS from the private sector thinking, well, why can't they do this? Other organisations can make this change. Other organisations can implement these processes, implement these technologies. I understand, for all of the reasons that I've been through, for all of the reasons associated with the complexity of the organisation and the NHS itself, this is tremendously difficult. And for that reason, I equally fervently believe that it's incumbent on the NHS to look for help, to look for support to achieve some of these objectives. So I think, therefore, there is an action, there's a collaboration required on both sides of the supply chain, if we use that terminology. And I think it's incumbent on suppliers to take a share of that responsibility, to understand their obligations in respect of delivering tight information management processes. And all of that will help embed the practices, the new technologies, the initiatives that we all want to see, the sorts of things that we're hearing about today. And this is about trust. This is about collaboration. This, I think, and again, I understand the culture. I understand the thinking, the mindset that's prevalent in a number of organisations, particularly large organisations. I understand the suspicion of bringing external suppliers into what can be some very sensitive areas which do impact clinical processes and clinical effectiveness. I do understand the risk there, but I think we're at a point where actually there is value and actually there's a bigger risk that we need to confront and understand. And that has to happen with the endorsement of all levels of the organisation. So this has very much to be top down, and it has to be. It needs the engagement of all of the stakeholders, clinical management, and so on. So the commitment to manage information is not one that we can afford to take lightly. And from my perspective, there's an offer on the table from me to help any of you out there in NHS organisations to understand the level of risk and to understand the information management process in the context in which I've described it. And from my perspective, what I want to do is invest in putting together the expertise, or bringing together some of the expertise that can really focus on, particularly on the NHS, and to understand some of these issues. And as I said before, I do believe that managing risk is something we could do, and by doing so, we can reduce costs. So, just in conclusion, then. NHS organisations are some of the most complex organisations on the planet. So this is hard. It's hard stuff. If we're talking about large-scale technological transformation, it's hard stuff. It's really hard stuff, and we need to be honest about that. And NHS organisations need to be honest about that. Sound processes. They could be basic manual processes, but they're better than nothing, and sometimes there is nothing. We just don't notice it. Sound processes form the basis for effective technology enablement. There needs to be that absolute recognition of obligations in respect of information compliance and security and of data protection. This is absolutely mandatory now. And fundamentally, if we get it right, with the right processes, we can support and improve the quality of patient care and reduce costs. Lastly, again, help is out there. From my perspective, it is all about wishing to offer the help insofar as we can. We've got specific experience, expertise around certain areas, and I think now it's the time to share that and to really understand the concerns and the processes that you all confront on a day-to-day basis. I just wanted to leave you with a bit of a reality check, and this comes from one of my colleagues in the States, and I think it kind of sums up what I see and what I've tried to articulate today. So fundamentally, hospitals represent an inefficient patchwork of systems, processes, decisions built up over the years. Again, this is interesting. I have a perception that in the States things are much more streamlined, organisations are much more mature, less fragmented, if you like. Not necessarily so, says my colleague. If a hospital has poor processes for storing and managing hard copy medical records, simply digitising them will add to the mess. Again, an interesting perspective, which I think plays to my point earlier about how we manage that change process. So health systems that streamline paper storage and the workflows, the processes fundamentally, can establish that framework for introduction of electronic systems to manage healthcare records. And what he's saying here is that there are those cost savings. They've identified potentially for each hospital $1 million worth of savings, which can be used to fund the transition to a technology-enabled world. So that's me. As I said, open to questions now. Prefer a discussion because I might not have all the answers. But thank you very much for listening.